Well, hello everyone. My name is Christian Santos. I am the proud chair of the FCHIP Youth Health Ambassadors. Today I want to speak with you about our approach to building resilience in our community, which is primarily done through the ACEs Stress Buster wheel that you see on the right. This wheel basically just showcases 7 different evidence-based strategies of how to manage everyday stress and especially intervene in toxic stress at this core level as it relates to our own personal adverse childhood experiences called ACEs. We structured our curriculum surrounding these 3 highlighted focus points in which our interactive learning modules were held virtually 2 to 3 times a month. Each month was a training session of a different strategy in which were held between 1 to 2 hour sessions and were recorded for the students' convenience and so they could review it with their families and friends as well. Our curriculum mostly centered around focused on experts from our local community-based organizations, in which were diligently chosen for their knowledge on each specific strategy. And then with the knowledge, the students use the knowledge for our biggest component, which is our end of the month community active service. And so during our active service, we mostly wanted to focus our curriculum surrounding that and community outreach to focus on low-income, under-resourced communities that our students reside in specifically, just because we wanted to have very impactful work and meaningful work to combat stress, especially in their home life, school life, personal life, etc. And so just to have an amazing starting point, we had our students complete a certification training centered around trauma-informed care, in which our students provided tons of feedback ranging from having an increased self-awareness to knowing how to respond rather than to react, meaning that this was an overall great conversational starter when learning about mental health. And so before I go into what we did and why we did it in our modules, I want to discuss how we went about creating the curriculum, in which we wanted to have each of our experts and our trainers talk about the what, hows, and whys, about not only what is the problem, but why is it still a problem? How does it affect me mentally or other factors in my life? And what can I do about it? And so with that in mind, in our nutrition module, we had a local pediatrician talk with our students about not only the science behind nutrition, but what were the historical and structural contexts of food swamps and deserts and other inequities that we see today. And so then afterwards, our students did a little interactive game with code names, which is kind of like a match the term and definition game with creative hints. And most importantly, our active service, in which our students created from scratch infographics both in English and Spanish, in which they handed these infographics out in local food banks and swap meets. In our next module, it was much of the same, learn about answer those what, hows, and why questions, but we mostly focus also on social determinants of health, which is basically factors that influence health outcomes from community members. And so with that in mind, our students for active service did a case study in which they talked about their real world experiences or fictional experiences, and then they identified what social determinants of health were affected in those and provided local resources to combat those. And then for our physical activity module, this one was really fun. We had our students create videos in which were at home or at school with their friends and family. Many of our students did workouts, did sports with their siblings. It was really interesting to see that. And interesting enough, one of our students who was interested in becoming a firefighter went to our local fire department in Fresno and interviewed and spoke about the importance of physical activity there. And then finally, for our mindfulness practice module, we worked with Soluna app, which is a startup, statewide app that's coming up that's wanting to provide local mindfulness practice education and resources. So we worked with them and we really focused on yogas and breath work to really center on being present in the moment. And so then for our active service here, we went to our local university at Fresno State, did some mindfulness practices and out in the open to promote it and also just to promote the app itself. And then in terms of extra opportunities, we also had our students participate in our own version of BrandCap, similar to the BrandCap that the challenge offered as well. That was much more personalized, making them understand their own personal attributes as well, and then have them talk more about ACEs in the community and also do some legislative advocacy work as well in Sacramento. In terms of our impact, we have seen an overall growth in terms of personal education and overall growth in their personal lives, in their family lives, and this was done through being able to feel connected with their community. And then for some next steps, we hope to finish off our modules and for sure complete a polished, more sharpened a curriculum so that way it's shareable for others who want to do similar work to what we're doing with ACEs. And what we didn't expect is that we'll be working with the California Office of Surgeon General. We have the opportunity to work with Dr. Gilgoff, who is the leading pioneer in ACEs and toxic awareness advocacy, and also participating in the statewide campaign. Once again, my name is Christian Santos, Chair of the Youth Health Ambassadors, and thank you all for letting me speak.